I'm a psychiatrist. I graduated from the Northern State Medical University in 2010. In 2011, I got a specialization in psychiatry. I should say I really like psychiatry, and when I was in the fourth year, I read my first book about it. I clearly remember what it was. It was a book by Kandinsky on pseudo-hallucinations. I was absolutely captivated by it. It was so interesting for me that I almost forgot all about my other studies. Psychiatry was the only discipline that appealed to me that much. I'm still absolutely devoted to it today. Now it's been for more than 10 years. When I was studying, I read a lot about it, and I had a very romantic view on psychiatry, that it's a very interesting science. But later, when I started working as a doctor, I came across a completely new reality. I had to follow certain procedures and recommendations and standards. And I noticed that, in reality, psychiatry could hardly help some people. As a rule, a mental health condition is a very tough, chronic disorder, and we cannot really treat them completely. So what does a psychiatrist do? They choose the relevant treatment in order to stabilize the condition of the patient, who later lives with that, while the doctors try to do their best to achieve prolonged remissions. What does it mean? It means that a patient doesn't have any relevant symptoms and they can live a quality life. They work and they socialize with other people. Unfortunately, well, only very few doctors think how their patients see this world. For example, how they see this view, if they have depression, how they feel in the remission phase of their illness. Psychiatry openly say that we don't know the real reasons for many mental health issues. There are numerous theories given their reasons for such issues. But the truth is that we don't really know the real reasons for such conditions. We try to make people's lives easier using the knowledge we have. And it's sad to see that the treatment doesn't really help or doesn't really work completely. In the past, I thought a lot about it. I studied for so many years and I read literally hundreds of books. But I still couldn't really help my patients apart from giving them the treatment and giving them my support. At the times I see that a person has real mental health issues and we cannot do anything about it. During the training, it became clear to me why psychotherapy doesn't work. The main reason is that they don't tackle the root cause of the problem. Firstly, because we don't know the reasons for mental disorders, and secondly, because people have to treat themselves and get their results by changing their perception of the world. If a person decides to take up the training and is ready to listen very attentively, then they can sort out their issues themselves without any help from the doctors. They don't need a psychotherapist, and it's great if they don't really need the pharmaceutical treatment as well. But that, of course, should be decided by the doctor. However, the main idea is that the root of the problem is treated by the training. I strongly believe that the system-vector psychology has to be the main subject in universities and especially in all medical schools. It would advance our medical science and psychiatry as well. And thanks to the system-vector psychology, the psychiatry could develop greatly and understand where exactly lies the cause for many mental health issues. This knowledge is vital for any doctor. During the training, I got a deep understanding of the psyche of the people. I couldn't get this knowledge before this, either with the help of psychiatry or psychotherapy. I was able to understand the reasons for developing this or that mental health issue, and why some people suffer from them, whereas others don't. Why one person can suffer from depression and the other one cannot have it at all. Why someone can have panic attacks and the other one cannot. During the training, I was quite suspicious of some things and even tried to check them, especially when it came to mental health issues. On the one hand, I had to admit that yes, I saw these things in my professional life, and on the other hand, I couldn't accept the fact that a psychology training reveals the things which psychiatry doesn't know about. I couldn't understand why psychiatry doesn't know about it and this training does. How can it be possible at all? It was a surprise. So I decided to check it. At that time, I was working with the kids diagnosed with autistic disorders. Every day I came to work in order to prove Yuri wrong. And I wanted to write to him and ask him to stop the training. I tried to understand each and every situation, and every time I got the proof for Yuri's words, because it was as he described it, and now I can see the reasons why it is so. I had a lot of insights of that kind, and yes, the training does work. Yes, you can see it in your everyday life, and I wasn't able to prove the training wrong, though I had thoughts like that. After the training, I started to understand the root of the problem the person has, and it helps me to work better with them. People with mental health issues usually go to psychologist or psychotherapist, or when things get really bad, to the psychiatrist. At times, this process takes a long time and the problem only gets worse. At the time, I have to admit that a psychotherapist can give some relief. So I can admit that, yet it doesn't give the solution, because the solution lies in the person's understanding of their problem and a deep understanding of their own psychic. When they can look inside themselves and say, oh yes, I have this because of that, and when it happens, everything changes by itself, and the person doesn't have to go to psychotherapists or waste their time on years and years of therapy. Yuri Burlan's system vector psychology helps to change your life and understand other people. In other words, that's a highly practical skill that you can use all your life. Before the training, I didn't feel that I belonged to where I was. My work didn't interest me that much. Well, I fulfilled all my duties, of course, but I couldn't find an individual approach towards people. After the training, I can see the difference in the inner states that people have. I can even use different medication depending on that. Before the training, I did my work of a doctor, yes, but after the training, I got interested in people and their inner world and their inner state. I started looking at them and listening to them with a great interest that I couldn't even stop. I wanted to work more and more, to see more and more people. It was a fantastic feeling. I was glad to see every person. I never got tired of them, and I never do now, and I don't have any burnout. I think I'll never have it, actually. As for me, the system vector psychology by Yuri Burlan is a unique scientific methodology for healing oneself and understanding the world and a very happy life.